I think people genuinely are going to look back at how we do dentistry the same way as how we look at like medical care from ages and ages ago.
We're doing surgery on awake people all the time, every day.
It's microsurgery.
ADEC's Smart Start program offers first-time practice owners their deepest discounts on equipment and furniture for 2 years, plus other savings and complimentary services. Ask your ADEC rep for details and start smart with ADEC. Join Doctors Savanah Craig and Ronnetta Sartor as we navigate life beyond graduation. Real conversations about forging our own paths in our early years in our careers. There's a reason it's called practicing dentistry. All right, welcome back to another episode of Beyond Graduation. I'm Savanah Craig, and with me as always,
I'm Ronnetta Sartor, and today we have a very, very special guest. Her name is Dr. Meredith Gantos. Say hello to the people for us.
Hello, hello. I'm definitely a little special, that's for sure. Great word to describe me. Definitely
In
feeling
all of
extra
the
special
good ways.
today.
All of the good ways.
In all the extra special ways today. But yes, thank you.
that's perfect. Meredith, if you'll give us just a little elevator pitch, tell our listeners a little bit about yourself, coming to us from cold Illinois this morning.
Yes. So I am a UIC, University of Illinois Chicago graduated in 2014. I did a 1-year residency down at the VA in San Antonio, Texas. So I did it in AG then, and then decided I should never work in a dental office and open my practice and see how that goes. So never stepped foot ever in a dental office. Even before dental school, I actually never stepped foot in a dental office. I lied about my shadowing, but I don't think UIC can revoke my doctorate at this point, so I can say that out loud. We had a family friend say I shadowed him, but so then I graduated my residency, came back to Illinois, acquired an older practice. That's a hoot and a half of a story that I'm sure we'll get into at some point, but a lot of lore there for sure. But acquired a practice and stayed at that location for a few years. My kind of thought in doing it was, if I'm crazy enough to do this, if I completely bomb and fail, then we can just kind of walk away from it. And if not, then I'll, do a nicer build out and a real kind of more robust type of situation. And so was there for 3 years, then did a brand new build out like 2 miles down the road, moved and grew the practice. And actually February 2nd will be 10 years of like having this practice, which is wild to think about, quite frankly. But yeah, so have been doing that since. And then I was late to the game on most things. So got married later and had my first baby close to 40. So it's been interesting and, doing everything kind of backwards, but it's been great.
That's amazing. Okay, so why dentistry if you had never, shadowed and all of those things? Tell us what that journey was like.
Yeah, so I was definitely exposed to the dental field. I have a lot of my family members have worked in dental sales, so they worked for Henry Schein. So I was like a kid playing with like the alginates. Like my dad would bring home alginate, and like it was like a toy. Or like I remember sitting in the back of his car and he'd have the books that have all the little birds in it, and I'd just be like turning the book. So I was certainly exposed to dentistry. There's actually, to be honest with you, there's one material he would bring home when we were kids that we loved that I still have no idea what it is. I've never been able to find it. I have no idea what this is. It's like these little like pellet beads, and you like heat it up and then you can sculpt it, but I still have no idea what that is. So I was definitely exposed to it. And then for me, as geeky and cliche and like ridiculous as it sounds, truly dentistry is such a healing art. And I'm very artistic. Like I love just the shape, the contour, the proportion, just the sculpting. I really like that aspect of dentistry, and I love that it's something that I can still serve people and be compassionate with. For me, it was very much kind of like, okay, if I have sort of this innate artistic like skill, how can I use that to better serve others? And it was just a really good melding of that for me. But it was really funny because I was like, because I never, spent my summers doing what I was supposed to do as a good candidate and being in an office. I worked, of course, as the arts and crafts director at like a summer camp. And so I'd be like the like wacky like arts and crafts lady. And when I would tell people like, oh yeah, I'm going to dental school, they'd be like, what? People would give me like the most side-eyed look, like, huh? Like what? You're going to be a doctor one day? Like what? So yeah, definitely a little interesting path.
So tell us how you got from spending summers doing all the artsy things to getting to the level of mastery for the Academy of General Dentistry and Sedation, and then also being, decorated with all the achievements in dentistry that you have.
Oh, well, thank you. I appreciate that. I mean, so I'm very much a driver personality. I'm also just honestly a very like inquisitive person, no matter what it is. Like I want to know how things work. I'm always very much my mind works in problem solving, which again is another reason dentistry is great because honestly everything is like a unique problem that you're solving all the time, right? But I feel like for me, when I got through dental school, I really liked it, especially the clinical aspect of it. I felt very good in my experience at UIC. And I, even at that point, was kind of like, okay, I sort of know that I want to have autonomy over how I practice. Like that was pretty clear to me, even as like a dental student. I was like, I'm probably not going to be the good, like, personality type of someone telling me, like, what materials to use or like what number of crowns I need to cut or things like it's just not going to resonate well with me. So I actually was really torn in wanting to specialize and I couldn't decide if I wanted to do pros or perio, and I had really good relationships with both at our school, very good mentors, they were awesome. And one of the perio residents at UIC, I was talking to him about it. I was like, I can't decide. I feel like I want to do one or the other, but like I love both. I don't want to not cut a crown, but I also don't want to like not do crown lengthening. And he had mentioned that he had done this residency program down in San Antonio and that it was really robust and that you get a ton of perio pros experience. So he was kind of like, why don't you do that and see which one you love more and then figure it out from there. So I was honestly not planning on doing a residency. The last thing you want to do when you're like millions, not millions, but a lot of money in debt. Close enough. When you're in debt, right? Like the last thing you want to do is just not make money for another year afterwards. But
we both did a residency too, so we hear you, we feel you. Yeah,
completely.
Yeah. So, so I ended up, it was the only one I applied to because I was like so late to the game. So I was like, okay, let me just try and jump on this bandwagon. And fortunately it worked out for me.
Got into a really impressive residency.
Thank you.
Yeah.
Honestly, I'm sure so much of that was just like, luck and stars aligning. But got into that residency. It was, as I'm sure you guys and your residencies were, I'm sure similar. It was honestly like the hardest year of my life. It was so much work. It was actually so hard that like, this is a side story, but it was so ridiculous that when I got into practice, my schedule, I just did 3 12-hour days back to back. And I thought that was like a vacation. And I was like, this is great. I'm just doing like 3 12s and this is amazing. And meanwhile, like the team was like, this is torture. We can't have. Yeah. I was like, I was doing this like 5, 6 days a week. Like, this is great. But anywho, so it was super hard mentally, physically, emotionally, like all the things. Residency, like really kicked my butt. But, I have to say that it also made me like the dentist that I am. It taught me a lot of skills. I went into it thinking I was going to come out of it and know what I wanted to specialize. And instead I came out of it and I was like, oh, forget this. I just want to do all the things. Like, I'm not,
I can do everything.
Yeah. Let me just do all the things here. It also cultivated a love of sedation dentistry for me that I had like zero desire to do. We had an IV lab at UIC and literally had one of my girlfriends sign my name on the attendance sheet. Didn't even go because I didn't want to be stuck. I was like, I'm never going to do this. I'm not. Like, just sign me in. When
we're telling all the secrets today.
I know. I'm going to get a call from like the dean of UIC. Like, yes. You literally have to come back and repeat your 4th year.
This is all alleged.
Yes,
allegedly.
Yes. Allegedly.
Hypothetically. In theory, I may have. And then when I knew that we were doing sedation in residency, I was like, yeah, I'm not here for that. But if you're going to make me do it to like complete this program, I guess. And I was also naughty there. And I really am like, gosh, I'm kind of a misfit as I'm talking. But we were supposed to do like all of our own IVs and all the things. And I was kind of like, yeah, I'm not ever going to do this outside of here. So I just had the nurse do everything and like also didn't really do a whole lot. And then had to get out and pay the price and retake classes and redo things. But it ultimately made me realize like, oh, this is actually a really cool service for people. And I should probably have been doing this a lot more and paying a lot more attention to making sure that this is great.
The foreshadowing for everyone who has not yet read Meredith's bio is that she not only does sedation, but she has very impressive credentials from the College of Sedation. So.
I do a lot of sedation. Yes. And I've since made sure, and I do it very safely and have lots of training in it. But definitely my initial introduction to it was maybe not taken as seriously as I should have. But anywho, so residency was fantastic, got a lot of really good experience, and then finished residency and said, I'm going to buy practice. Of course, that's a trip and a half trying to do that. Anybody who's done that or who's looked to do that knows it's kind of like buying a home. It's like you think you're going to find your dream one, tour it, make an offer, land it, and in reality, all you do is get your heart broken like 14 times and you're on a whirlwind. You can't find what you're looking for, and it's crazy. So especially when all you have is debt to your name and like nothing to show for yourself. So yeah, finished residency and then acquired my practice, which again, I'm sure we'll talk more about. But after that, I really have such a love of learning and like being inquisitive that I really honestly funneled like any money I was making either back into the practice or into CE. So, and I also very much acknowledge that I was in a unique position where I'm not supporting a family. I don't have kids. I live very well within my means. In fact, I lived at home, honestly, the first couple of years I had my practice as a full-fledged adult. So I was able to really do that and invest back in myself. But it certainly paid off tenfold because the more you learn, the more you can do, the more you make. Sedation is also a very profitable service. A lot of times you're sedating someone and doing a lot of dentistry. So because of that, I was able to take Pinky, take Coys, take all these other, Mod Institute, all these different types of CE courses, and really just, again, keep investing back in myself. And so that's been fun. And, I used to joke about how I just worked to fund my CE addiction. But, sometimes it does get you a couple extra letters after your name and things like that. So it's been fun, and it's been just a wild ride. I feel like I've had like a 40-year career in like 10, 15 years, whatever it is. It's crazy.
You're in good company here. We're also CE junkies, and
Love
Ronnetta
that.
and I were both trained in sedation. I do sedation in my practice now, so totally hear that.
I love that. Can I tell you how awkward it is being like one-sided? Because like I feel like I want to like ask you guys so many questions.
No, go for it.
Okay,
go for it.
I'm like, I don't know if that's, but yeah, like I would love to hear more about like y'all's story. I love the little I know about how you two connected is so great. But yeah, I mean, I'm super interested in y'all's background as well.
Yeah, no, it's our podcast. We can do whatever we want. So
okay, I wasn't sure. I'm like, am I just like sitting here answering the questions?
No,
like every time you ask something, like I want to like turn it back and talk to you and ask you.
No, totally,
also.
Go for it.
I feel like that makes for the best podcast.
Yes. Okay. Tell me more about your sedation experience, because people are so afraid of sedation. It's
absolutely
wild. And it's phenomenal. It's a great service.
It's absolutely the best. So Ronnetta and I connected through Ignite, but we both did the same residency program 5 years apart in Columbia, South Carolina. So that's where I got my sedation training, and I absolutely love it. It's my favorite thing to do.
Now, was that a university program or VA, or what type of program?
It's a hospital program.
Oh, cool.
So it used to be Palmetto Richland Memorial GPR program.
Nice.
But literally the dental center is right across from the emergency department.
Oh, cool. I bet you guys got like a lot of cool surgical types of stuff then, and like just like real nitty gritty. Love that.
Yes.
Oh, yeah.
Yes. My first, you're a July 1 resident, and your first weekend on call was like multiple gunshot victims, and they're like, you're gonna go with plastics, and you're gonna take the teeth out, and then they're gonna do the rest, and you're like, great.
Wild.
Awesome.
Oh my gosh. I don't want to say that's so cool, because obviously like, it's like delicate to say that, but like obviously like you don't want that for anyone.
Yes.
And I'm sure that's very emotionally taxing, but what an interesting experience to get to work side by. Oh my gosh, that's wild. I want to do this residency now.
Yeah, I loved it. It was awesome.
It was fun.
But we were kind of the end all be all. We didn't have, there were community specialists, but nobody affiliated with the hospital. So I mean, we did implants, we did thirds, we did molar endo, which I hated, so then I don't do anymore, but we did.
I don't
Same
either.
girl. Same
I don't
thing.
either.
Samies. Let me tell you.
Look at all these really well-trained
Yeah.
women here, and nobody likes molar
When
endo.
you know, you know.
Yes. Honestly, I perfed once in residency, and that was enough for me to be like, never again. Nope, not doing it.
Mm-hmm.
It still haunts me clearly to this day.
Yeah, I decided to take endo CE again, and it was molar endo in the little blocks that we had. I perfed the block, and I told Savanah that was it. No.
Yep. I did the same. I went and took Steve Buchanan's course in
Me
California.
too.
Okay. I took that and I still came home and was like, still not doing endo.
Yes.
But I will say I took it with a girlfriend, and Steve is obviously amazing and phenomenal, and his course is phenomenal. But
he's a character.
He is, and he got really pissed. He was having an issue accessing and finding all the canals when we were there, and he was doing the live one, and it was wonderful. Like, I turned to my friend and I was just like, if Steve's having a hard time, like, I feel good. I'm content. Like, I'm not gonna lie, I secretly loved that he was getting mad and like struggling to find. I think whatever it was, MB2, or he was some canal he was having a hard time finding. I was like, I feel good right now.
That's so validating.
It was so good. There's nothing, you know what? Like, when you just like meet like these amazing people and they're so good and they're at the podium, you're just like, God, like these people, like they just cry unicorn tears and everything they touch just like turns to gold. And you know what I mean? It's just like these people, you always forget that like they deal with the same BS that we all deal with.
Correct.
Right? It's like so hard. But when you see those humbling moments, you're like, yes, he got pissed and he can't find it either.
Yes.
I hope that ruins your day too, Steve.
That's amazing. Yeah, so validating. But so then I have been at my practice. It's a big group practice. I've been there since I finished residency. When did I graduate, Ronnetta? 2022? 2023, I left residency and have been here almost 3 years.
How rare for like your first job to be the one that's like a good fit and you stick with. I feel like that doesn't happen for people ever.
Yes, very fortunate. I credit, the skills I had in residency for like making me a marketable associate. So, but my boss very fortunately was like, we want you to come do sedation. I'll buy you the things you want, set it up how you want. And I was like, amazing, because I have nothing but debt, just,
Yeah. No, that's awesome. And then you totally know the sedation stuff. I mean, what a very great way to help people, but also profitable, right?
Yeah. And it's also, I think, takes a very delicate type of person, because you are getting the most fearful, most overwhelmed, unwell humans.
100%. 100%. I mean, you get everything from I cried tears when I walked down the toothbrush aisle in Walmart.
Yeah.
To I was sexually abused by my father, who was a dentist. So you get like the full gamut of just honestly things that I'm probably not even qualified to deal with, but I do my best. And I just try and help people in any way and capacity that I can.
The best that I can.
Yeah, it's definitely a different patient population. And I think it does do well, honestly, with women. Like, we need more women doing sedation because quite frankly, we're the ones that are so much oftentimes more emotionally in tune and patient. Yes.
And it's cool because, you have that anxiety for the patient coming in. And then when you do the treatment, my assistants and I always laugh that it's kind of our break day of like, we're not like, once the IV's in, we're like, everybody is chilling.
It's so great. And you're just like cranking Fetty Wap in the background. You're like, God, I hope this patient doesn't record me on their phone.
You're just vibing. And then afterwards, it's so grateful because they're like, oh my God, all my work is done. And this has changed my life.
Totally.
In your practice, are you doing sedation for big surgeries? I do a ton for restorative and like SRP, which is not at all what I thought. Okay.
Yeah. So no, typically, honestly, it's like all their dental needs. So you're doing the SRP, you're doing the indirects, directs, extractions. Yeah. It's not just like big implant cases or things like that. It's more just like comprehensive care.
Yeah.
And the thing that I love about sedation, and I would be interested, if you find this as well. But I always tell people too, a lot of times it just takes one sedation experience. Like you have one positive dental experience, we reset your mouth. And then if you need a filling down the road, you need your, maintenance cleanings, whatever it is, they can do it without having to be resedated every time. I can count on one hand the number of patients, and I have them, right, where they have to be sedated for everything every time.
Yes.
But that it's so rare for that. It's like you just need someone to like reset the experience once, and that's all it takes.
No, definitely. And I think it's less overwhelming when they come in and you're like, okay, you haven't been here for 20 years. We've got a lot of work to do. And then one occlusal here and there doesn't freak people out. But I had a patient who had a lot of traumatic experiences in their life. And, it manifested in all medical settings, but especially the dentist, right? And I tell patients, it's vulnerable. You're trying to sit here basically in my lap with your mouth open. You can't breathe. Like, it's not fun. And I laugh because my mom's a dental hygienist, which is kind of how I got into this myself. But I was always like, I don't know why people are afraid of the dentist. And the more dentistry I do, the more I'm like, this sucks. Like, I don't know why anybody's doing this awake. Like,
I agree. I actually say this all the time to people. I genuinely think, how we look back at people and we're like, oh my God, they used to use leeches to like suck the blood out of people and that was medical. I think people genuinely are going to look back at how we do dentistry and it's going to be as barbaric of a thing. Like the fact that we literally just like grab out your nerve out of your tooth while you're awake, like your live nerve, you just strip it out of there, or we just crank on your tooth and break it out of your bone, and like while people are awake is ridiculous.
We're doing surgery on awake people all the time, every day.
It's microsurgery, and it is genuinely horrifying when you like think about it on an intellectual level. And I think, our field has so much to advance, and I think whether it's sedation, whether it's just, our treatment modalities will be totally different, right? When we're just growing back tissues and things, but people are going to look at how we do dentistry and they're going to think about it the same way as how we look at like medical care from ages and ages ago, like when they're like sucking blood out of people and just draining them. It's insane. It's genuinely kind of insane. But I actually really love, and I think it speaks to why I'm sure you are like such a loved, wonderful, compassionate sedation dentist and human being in general, the acknowledgement of the vulnerability, because I think that is something that you have to understand in this profession to serve people to the best of your ability. Because to your point, your mouth is a really intimate place, right? Like we're inside someone's body. They have to put complete trust in a stranger.
Yep.
We're working in such a small space with the very, clear ability to inflict pain at just the smallest motion. They know that. And then what's crazy to me about it afterwards is they can't see it or assess it afterwards, right? It's not like I'm working on their hand and afterwards they can look, and be like, oh, my, cuticle's off, or, that nail's a little crooked. Can you, right? Like, so after that whole experience of lights in their eyes, smell, sound, complete trust in a stranger, potential at any second to feel pain, then they don't even know if it was done well or have no concept of like, I can't even see what happened. It is such a wild experience. And I personally like my side of the chair, love it, comfortable there all day. When I'm on the other side of the chair, like get me the F out of there. I don't want it. Like I had to have an endo done, and literally I just had to have like it was an anterior. So I just needed like a lingual resin on it. I was dying. I literally was just like, I didn't even have to be numb. I was in the chair for like 10 minutes and I was just like, this is terrible. I hate this. I hate my life. I hate everything. Why?
Yes.
And like it just sucks. It just sucks.
No, I hear you. And that's why I'm like, sedation, it's just so nice. It's nice for everyone, because I'm not constantly like, open your mouth. You're okay. I got you.
Yes.
You're okay.
Yes.
And don't get me wrong, listeners, sedation is not the silver bullet. There are easy sedations. There are rodeo sedations.
There are definitely, that's also true, I guess, and fair to say.
Like,
but even those make for really good stories too.
The funniest. And it is always the quietest, littlest human that is like
strongest,
throwing arms, and you're like, how do you sleep at night? Where is your spouse? Are they okay? Like,
Yeah.
100%.
It's almost
100%.
like I've got a little FOMO, but not a little FOMO. So a little bit of my background is I graduated in 2017, completed the residency in 2018. And then I went to group practice where I also did sedation dentistry, like IV sedation and stuff. And so the FOMO is the chill, setting the vibe, being,
Yes,
you know,
yes.
patient, being okay and being done. But the rodeos, I do not miss those at
Yeah.
all.
Are you not currently doing sedation then, or are you not at that practice?
So I was at that practice for about 4.5 years. I thought that's where my forever home was going to be. Was thinking about buying in, and then an awesome opportunity just 15 minutes from where I live came about. So
Oh, that's hard to pass up.
about 3 years ago, I went the practice ownership route and acquired a practice. And it's a small practice, similar to what it sounds like your first practice was. And so right now trying to convert certain things to like be allow for sedation dentistry will be a
Totally.
little bit more difficult from a space perspective, but I do minimal sedation, so I'll do laughing gas plus oral sedation, and for most of those patients it helps out, so I'm doing it in some regard, but I'm not getting the good effects like you guys.
Honestly, that's how mine was like that too. When you,
Mm-hmm.
firstly, when you're in the practice ownership, like you're busy enough, you've got enough on your plate. And then when, you're just trying to navigate all the things, sedation, I will say, like, you have to be in the right headspace. Like for me, like my team knows when I do sedation cases, I don't see patients after. Like I've given everything I have of my
Mm-hmm.
physical, mental well-being to do that case. And when I'm done, like I'm done with it. Unless, of course, if it's like a single implant or something, but like those kind
Sure.
of comprehensive cases,
Yeah.
like you're just so mentally alert and tuned in, and you just have to be so dialed in, right?
Mm-hmm.
Yeah.
So when I first was doing my practice stuff, I wasn't doing the IV stuff either. I would do oral sedation and this and
Yeah.
that,
Mm-hmm.
like you, but I didn't even place implants right away. Like I was just kind of like, let me just get this thing, like I don't know, get whatever the phrase is, the cart on the horse. I don't even know if that's
Yeah.
the right phrase to
Yeah.
use there, but
Yeah.
whatever. Like, let me just get my ducks in a row for like a
Yes.
second and then build back up from there. So definitely, you don't have to have FOMO. I'm sure you'll be back at it soon enough. But I think that you're
I'm
smart doing that too, because you don't want to bury yourself in too
mhm.
much.
I'm still keeping my certifications and everything up,
Yeah,
so
that's what I did too.
I'm doing all of that, and then maybe I'll be back in the saddle sometime
Yeah,
soon.
100%. Okay, side note, was that a pink ADEC Yeti?
No.
No,
Oh,
no,
I thought
but it
that
is
said,
pink though. It's a
oh,
pink
okay. It was
Yeti.
super cute. And I was about to be like, ADEC, I want that pink Yeti. Send that to me. No.
We
ADEC, we
may
need
need to,
branding now. We should
right. We
tell
need
them.
branding. We need pink ADEC Yetis.
Listen, my ADEC Yetis are my favorite drinkware, but I don't have a pink one. And I saw yours and I went, is there pink that they're holding up for me? I
We're
only have the
gonna
green and the blue ADEC.
we're gonna talk to them about this.
Yes,
Yes,
please, let's
Savannah
get the
just
pink
made a
ADEC
note.
Yeti.
I did.
Yes.
I got a note. Meredith, tell me how you're doing, what your sedation days look like. Cause I'm in group practice. So it's nice. On my sedation days, I run my one column. I don't check hygiene. I'm in it just like you were saying, but I think it's an interesting balance when you're the only doc. So what does that look like for you, and I'm sure that's evolved over time.
Yeah, it depends. So I do have associates. So
Okay.
very early on, though, I was the only doc. But
Gotcha.
now I have had the luxury of I'm doing this, checked out.
Yeah.
You guys do your thing.
Sweet.
Prior to that, though, we had a very open flow, open type of setup.
Okay.
And or even in the new office, we have like the surgical suite is right across from like one of the main hygiene ops. So it's very easy to just like doors open, jump out for a second, do
Yeah.
something, jump back in.
Gotcha.
And I'm very mindful of like who they're scheduling, what they're scheduling. Like
Yeah.
I'm not going to see a new patient, obviously.
Right.
Or, chatty Kathy. It's like, nope, we're not doing chatty Kathy on that day.
Yes.
A lot of times too, to be honest, we can do things where it's like, okay, fill the hygienist up with the SRPs, the maintenances, the 3
Yeah.
month pro fee recalls. Just so again, like I'm a very, I don't know, like I think I'm good at multitasking, but at the same time, like what I'm doing, I want to give 100% to.
Totally.
So when I do the sedation stuff, I am very regimented in how I do it, how it's scheduled and things like that. Just because again, I mean, it's not stressful. I don't want to say it's stressful, but it's just, it requires intention,
Yes.
Like I can walk into my other days on like no sleep and still know that I'm going to function just fine. I feel like when you have a sedated patient, you owe them more than that, if that makes
100%.
sense. It's
No,
like
I totally agree.
Yeah, like I owe you my 100%.
Yep.
Because while we do everything to keep it really safe, and I know it's going to go smoothly, and they all go smoothly, and I've never had to reverse someone or had an incident, right? Yeah, exactly. Knock on wood. I still have to walk into every appointment with the notion that it could,
Yep.
and I have to be on point and prepared to do that because at the end of the day, like that's my role. I'm the only one that's ACLS certified. I'm the one that's going to be navigating. I have a phenomenal team. They're brilliant. They're wonderful, but they're going to look to me as they should. And I'm going to have to play that role of like managing any type of situation. So
totally. And there have been, I'm sure you've had, I get a lot of like special needs patients that come and sometimes there are reasons that you're not safe to be an open airway office sedation case. And I'm always like, we are not a hospital. I am it.
Yeah.
Like at the hospital, there is a code team and there is an anesthesiologist and like.
Yes. There's definitely patient selection is important. We do too, like a pre-sedation visit. So we'll do a visit, beforehand where we're going through everything. And that's always my time too, where I look someone in the eye and I'm like, I literally don't care if you shoot up heroin. I just need to know, like whatever you're doing, like here, update your medical history. And then I'll look through it and I'm like, I don't honestly care what you do, what you take. I just don't want to kill you. So just
100%.
tell me, like,
100%.
And then do you have like 9 times out of 10, they'll be like, well, I do smoke weed. I'm like, great, fine. No problem. Just
like if you could not a couple days before, it'll just go smoother for all of us. But
right.
Thank you for telling me.
I'll use maybe a little hydroxyzine too to like help make it a little smoother, whatever. But like stuff like that. So definitely do everything we can to be smart about it, meticulous about it, and good case selection. And even too, I mean, there might be medical history reasons why, there may be personality reasons why. I mean, there's definitely, we definitely don't treat every and all cases. So I did have one time that I just thought about where, because we did have kind of that open concept, I had the patient who was sedated and the patient like adjacent to them who was not sedated. The sedated patient was like being hilarious and like rambling and crazy and funny. And the patient who wasn't sedated, when I walked over, was just like, I want whatever she's having.
You're like, you can for a fee.
Exactly. It was like, that sounds like a great time. But when I was pregnant last year, I actually dabbled in experimenting with bringing in a third-party anesthesiologist.
Okay.
Just because I felt like being like super pregnant, like again, if I needed to do any type of emergency medical care, like, can I really do that being pregnant? I don't know. So I experimented with it for a couple cases, and it was, I mean, it works, I'm sure, really well in other offices. I personally like doing my own sedations. Like for me, it's not something I would have kept up with.
Yeah.
Like I like doing my own, and I'm happy to be doing back my own. But it was really funny and really interesting because, typically people who are bringing in a third-party anesthesiologist, like they're doing much more complex types of cases, right? Yeah. And so that's a more deeper level of sedation than what I'm doing.
Yep.
And the first patient that I did with the doc, it wasn't anything crazy. It was like simple restorative, simple comprehensive care. And so I said to him, I'm like, could we like just keep this like more moderate level? And he didn't want to. He like wanted to like intubate him. He like wanted to like go like full Monty.
Oh my goodness.
And I talked him into it, and I was like, well, can we just try? And so he did for me. And the patient, as you know, like it's conscious sedation. The patient at one point like moved a little bit, which does not bug me in the least. I work on, like obviously when we're doing sedation, like you're listening responses from the patient very often, right? You're like, how you doing? You doing good? Like they're moving, they're interacting with me. I don't care. But the anesthesiologist was so irritated about it. And he was just like, oh, next time we're just going deeper. Like, I like, I don't know why you talked me into this. And I just thought it was so funny. I was like, bro, I don't care that he like moved his arm like a micron. Like, it's
Right.
fine.
Yeah.
Right.
Like,
You're like,
This is our
also,
life.
right. My day today is on awake people
Yeah.
all the time.
Yeah.
Moving
Literally.
targets.
It was just so funny to me to be like, this is so different for you, huh?
That's
like you.
so fascinating.
Yeah, it was really funny. He was like super irritated that the patient, like in any way, like, not half dead. But so, yeah, so that was kind of interesting.
That is really funny because I'm sure you guys get this too. I mean, Ronnetta, you're not doing the sedation, but you do a lot of complex care. And I feel like in dentistry or even to the lay public, like I was at my husband's work holiday party and, being a dentist comes up, which is always scary. Like if you put your fingers in your mouth to show me something, I'm going to walk away.
Yeah.
Like, just so we're clear. But it came up that I do sedation and whatever. And they're like, well, when you're doing the sedation and like, who's doing the dentistry? I'm like, me. Like, I'm your girl.
Yeah.
And they were like, is that safe? And I'm like, obviously. Like,
no, it's actually really not, but I just do it anyway.
Yeah, it's just for fun. Like, I like to live on the edge. But I was like, no, because I know when I'm going to be done. I know, I just have this flow. And I feel like Ronnetta and I have talked about, like, she's getting back into placing implants. And, like, I know where I want this crown. Like, sometimes I've sent it to surgeons and comes back. I'm like, what? How am I supposed to do this? So I like that control aspect. And I would imagine that's how you feel with sedation.
Totally.
Yeah.
100%. And dentistry in general, just I want all the control. I want to know what I'm doing. And again, I feel like, because you hear that's a big criticism, right? You hear people say like, well, I'm just not comfortable doing the sedation and the dentistry. It's not for me. And while I understand that, I think if it's done appropriately with the right protocols in place, with the right team, with the right patient selection, it's really not, I mean, you do nitrous, you know what I mean? It's really not a whole lot different, right? Like, other than probably safer because they're hooked up to a lot more monitors, you're titrating things a lot more appropriately. Where I will say where I think sedation gets a bad rep and where I do think it can go sideways is these people who don't have the training, who aren't licensed, who say they do oral sedation, who are doing
so much oral sedation
with oral meds and are not, and have someone maybe on an SpO2 monitor, but you know what I mean? Like, that's where sedation goes cuckoo.
I am so glad you brought it up because I have this conversation on the daily of like,
it's
I can reverse them. They are so safe.
IV
They've got
is
an
infinitely
IV.
safer. Yeah.
Yes.
And you don't have the variable of like how it's going to hit them and when it's going to hit them and when they're going to oversedate. And then if it's a real quick procedure, you might send them and they go home and they're oversedated, right? I mean, that is where it's dicey, but doing IV the right way is, yeah. But Ronnetta, I'm so interested to hear. So tell me about, like, with your practice experience, what's been the biggest challenge that you've found so far? Because it's wild. It's a ride.
It is. We kind of just were talking about this before you came on, so it was fine. We were just chatting away before you came, but probably the biggest challenge is that I bought a dyeing practice.
Same. Yeah.
And so they kind of call it a kickstart practice where it's not quite a startup, but it's not quite standing on its own two legs. I bought it from a gentleman that was in his mid to late 70s. And he probably should have retired a long time ago, but had a hard time finding someone that wanted to purchase the practice. So probably the hardest thing has just been pretty much rebranding it and making it what I wanted to be, building the culture, but kind of doing it the way I want to do it too, and not focusing on the noise of like what everyone else is doing and how they're figuring it out. So probably the biggest challenge has just been the blood, sweat, and tears that lots of tears and stuff that has kind of went into it.
Lots of tears.
Lots of tears, yeah.
I can relate to literally everything you're saying. But you said something that I love, and I say this to people all the time, and I love that you actually like already know this, which is every single person who's walked the path of practice ownership because it's worked for them thinks that the way that they've done it is the secret sauce and that that's like the only way to do it and that's why you have to do it. because that's all
Mm-hmm.
they know. Like, I get it. That's what you know. It worked for you. And everybody tries to shove that down everybody else's throat. So everybody that you talk to, it'll be like, no, you have to be PPO. No, you have to be fee for service. No, you have to do Saturdays. No, you have to do like the amount of have to do's is wild. And the reality is it's because it all works. That's the beauty
Mm-hmm.
of it. It all
Yeah.
works. So you just have to be authentic to yourself, and it will work. And that's what's awesome about it. But I think people sometimes get stuck in these loops of like, oh, well, this person I admire says this, or this person who looks like they've got, driving the G-Wagon says this, or like whatever it is. And it's like, hey, it's because it all works. Like, it's all going to work out. Just be a good person and it's all going to
Mm-hmm.
work out. Be a good person, be a good doctor. Did you have to turn over the entire team, or were you able to retain some of the team?
So he only had 3 employees. So I inherited the 3 employees. I now only have one of those employees, and it was his hygienist. She had been with him for 30 years. He was the only doctor that she's ever worked for. But patients love her. And as long as she was staying, it was a good decision because the patients wanted to stay. And because of her, I think they gave me more of an opportunity to get to know me
Yeah,
than they would have otherwise. But pretty much she's the lone standing one from the previous office. But it's worked out because the new employees that I've hired and trained, they have been able to help grow the culture that I've been trying to instill in the practice. So
that's
it's
awesome.
worked out.
It's also, I can relate to, I'm sure you had this experience also, like having being a young woman coming into the old man's practice, especially
Oh,
when they
yeah.
aren't doing anything. You're like, why did we not take x-rays for 15 years?
Uh-huh.
Like, what? Why did we just
Yeah.
stop doing that? We just said no. um
Why did we fill implant accesses with amalgam, Ronnetta? That was your
oh yeah.
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 Or why were we not perio charting and
Yep.
recording it?
Oh
And
yeah.
so just doing a complete overhaul
All the
of
things.
all of the processes and everything.
Yeah, all the
Um,
things. There was a
mhm.
6-foot cactus chained to the wall so it wouldn't fall over on people when you first walked into the office that I bought. And I remember asking like the hygienist and the team that he had. I was kind of like, why did we permit this? Like, what were we doing with this cactus, guys? Like, no one said anything about this. And the hygienist told me, they were like, well, we tried pouring chlorhexidine into it, thinking it would kill it. And I was like, but it made it stronger because now it's like a mutant chlorhexidine cactus. I actually think the chlorhexidine like made this thing like even stronger. So I can relate. That, I mean, that's cactus, but it was that equivalent in the dentistry and in what was happening or not happening.
Mhm.
The doctor I bought my practice from actually called himself, which I thought was really funny, a referologist. Like,
Oh my
he would
gosh.
refer even for like sometimes basic dental things, but it was definitely stuck in the 80s, and the level of care was very different. And I don't envy where you're at, because I remember like walking in every day, although 3 years you might be through some of this, but like every day was like that constant battle of like, I have to like re-educate this person on what dental care is supposed to look
Mhm.
like why x-rays are important, why we probe, why we use a cavitron to clean now, why, like just the most basic of like things. And
Mhm.
every exam was so long and so tedious. And like with my transition, I was terrible because I took so long to get to have a bank give me money. By the time I actually got money, what I'd offered him, the bank had assessed his practice. Like, I was willing to overpay for his practice, so I'd offered like an extra 50 grand. But of course, the bank wasn't going to give me that, so they gave me what his practice was actually worth. So it dragged on, and then by the time I did get the money, I had to like come back to him and be like, "So it's like 50 grand less than like what I actually was trying to pay you." So, understandably so, the dude was like pissed and hated my guts. So the transition literally was February 1st. The bank, I went and signed the papers, and I called him. I was like, hey, great news, signed it, should be wired over. And he was like, oh, can you meet me at the office? I was like, sure. Meet him at the office. I hear him on his cell phone talking, and all I hear him say is, I'm not the dentist anymore, she is. Hands me his cell phone. It's his call service. It's like a patient emergency. I don't even remember what I did like with it, but so he hands me the keys. There was a fish tank in his office and he goes, "Do you want this fish tank?" And I was like, "No, that's okay." And he was like, "I'm going to take it." And I was like, "Yeah, sounds good. No problem." Takes his fish tank, walks out the door, never see from him, never hear him again. He didn't tell his team. He didn't tell his patients.
Oh
I
my
showed up the next
gosh.
day. I was like, "Hi." And everybody was like, where's this doctor? And he never sent the letter to his patients, never did anything that was,
Ooh.
obviously in like our purchase agreement, whatever, which I understood. He was irritated. But so I literally walked in. And of course, then every patient looks at me and they're like, "He would never leave and not say bye. Like, you did this. Like, you're a terrible human being.
Oh my
He would never do us
gosh.
dirty like this." And I was like,
He did.
But he did, yeah.
you
He
guys.
did.
Like, yeah.
Whoa.
So it was insane. It was just wild.
Did the team transition or did they leave?
That was a hot mess express.
Yeah.
So his admin, his front desk was embezzling from him. So she was smart enough to know that as soon
Tale
as
as old as time.
yeah, so she was smart enough that as soon as he left and I came in, she left immediately. Like, I didn't even work a day with her, which she was done that day, which made sense.
Great.
OHI doesn't typically have fees attached to it in everyone's ledger 14 different times. But anywho, so she left. So my dear sweet mom worked my admin for me for the beginning, which is really cute. It's really funny. Like, some of the patients that have been with me for forever, they're still like, "Did you ever move out of your mom's house? How's your mom doing?" They still ask me this. And I'm like, "Bro, it's been 10 years. I moved out. Okay."
Yeah.
Like,
Thanks.
cut her some slack. I was there for like a little bit in the beginning. Like, and yes, my mom helped me at work, but like, I'm still an adult. But
I love
anyway.
that.
Oh my gosh, it's so funny. And like, still to this day, some of them are like, did you do that?" Yes, I did that. I'm married and have a baby.
Yeah. Listen.
But yeah, so my mom helped me with the admin stuff.
That's amazing.
He had 2 assistants, neither of which truly like even knew how to hold a suction, because again, he was a referologist. He didn't do anything, like could not control alt delete to sign into a computer, like nothing.
I just like, how does one have a business and not do any business?
Right.
And pay their employees and stuff.
The practice
too.
was producing a year like $300K, and he was personally taking home like 25 grand or something. Like, I mean, like, it was just like the numbers were not numbering, right? Like, it was very ridiculous. Whatever. It was obviously like his social club or what, I don't know what it was.
Sure.
But it was not. We weren't doing dentistry and we weren't making money.
We were chatting.
We were seeing the people kissing the babies' heads, right? So, yeah. So admin left. The assistants, obviously, like, that was a really steep learning curve. So my initial approach was like, well, let me help these people, give them teach them skills, give them a career, whatever. They were older though. I tried. And I had my first incident was I had a elderly man. Actually, this is a crazy story, but I had an elderly man with dementia. I was taking out a tooth that had a crown on it.
Yeah.
And as you know, sometimes those pop off. So I'm taking out the tooth, the crown pops off. I turn to the assistant. I'm like, suction the crown from the back of this man's throat, right?
Yes.
And she looks at me, panics, pulls all the suctions out, and it's just like, what do we do? And I'm just like, what do you, like, suction the crown, and then of course crown disappears. And that was the day where I was just like, okay, there's a difference between like trying to help people and like it's endangering people.
Yeah.
And so then I did part ways with the assistant, but hilariously enough, one of the assistants, no joke, literally when we were having the conversation was like, but what am I going to do? I'm unhireable. No one would hire me. And I was just like, I'm really sorry. She literally knew she was like the worst assistant. She was like, and like, I felt so bad. I was just like, I get that, but like, I can't also keep you. But wild side story. So that patient that swallowed the crown, right? The guy has dementia, swallows this crown. So we grab his wife from the waiting room. I'm explaining to her. I'm like, hey, this is what happened. If you'd like me to send him for a chest x-ray, I can. He's not coughing. There's no breathing. More likely than not, obviously went through his GI. It'll come out. But obviously, like, whatever you guys want to do, I can do. So the wife's like, no, I don't think we need to like go for a chest x-ray. We're fine, blah, blah, blah. The patient out of nowhere, like, perks up and is like, I want to go for a chest x-ray. And I was like, okay, yeah, no problem. We'll like pay for it. We'll send you, we'll take you there, whatever. So send him to the hospital for a chest x-ray. And I get the results back. And the results of the chest x-ray, of course, are like, oh no, there's, no foreign dental material in there, but he has stage 4 lung cancer.
Oh my
And
gosh.
so they found it, and then he started treatment right away. And it was such a, like, I still have goosebumps every time I tell the story, because it was such a moment of like, I was so pissed at myself. I was so mad about the situation. I was feeling like the biggest a-hole. I was just like, God, like, I'm new to this practice. Like, I'm on my own. Like, I had this adverse outcome. Like, this thing happened. It's terrible. I just want to jump off a bridge. And then it was like, oh, this man is literally going to live longer because this
Mm-hmm.
incident happened. And it was just like such a wild, it's still wild to tell. Like, it's a crazy story.
No, I have chills. That's
Yeah, it's
Yeah.
crazy. I had actually a patient who was under sedation that I noticed weird stuff with his vitals, and we ended up sending him. And they came back. They'd moved to Vegas, and they like came back in town one day and came to my office and were like, "You saved this man's life." Like, he went to the ER. They admitted him. Like, he was about to like, I don't know. They did like some bypass on him. I don't know, whatever it was. It was like they did all this like emergency medical stuff on him, and they were like, we had no idea. And I was like, oh, I don't know. I just saw he was doing some weird things on there. I was like, maybe we should
Yeah.
check that out. But
dentists are doctors
anywho,
too, people.
yeah.
Yes.
Sometimes we get it right.
That's
Sometimes, but
that's such like a
crazy.
life is so wild, and there are
Mm-hmm.
those moments of like the worst day of your life, or like the bad outcome like turns into this thing, and like what a special lesson. That's Thank you for
Yeah, it
sharing
was,
that.
well, it was just, it's like you always try and find the teachable moment in everything. At least,
Yeah.
like, I feel like you have to, right? Like, you can't get
Yeah.
through life if you're like just grumpy about everything. Like, everything has to be like, what's the purpose? What can I take away from this? How can I be better for this? Like, kind of a thing.
I mean, don't let
And
your patients swallow their crowns if you can avoid it.
yeah,
Right.
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 But it was just one of those things where it was just like, okay, here I am being so self-absorbed, throwing my pity party,
Yeah.
hating on myself, being just like so mean to myself and mean about the situation, when in reality, like, what a weird blessing. Like, that
Mm-hmm.
family was so appreciative to me. Like,
Yeah.
they were like praising me for this man swallowing this crown. And I'm like, thank you. Thank you. I work hard at being terrible at what I do. And, thank you very much.
Yeah.
Right? Like, but like, I don't know. Life is so funny like that. And I will say, that's one like big lesson I've taken away from practice ownership is you're going to have multiple, and I'm sure it's life in general. I'm sure, honestly, like, no matter whether it's ownership or not, but like, I feel like with ownership, especially, like, when you first get in there, it's like you're trying to hold sand. It's all falling through your fingers, right? And you're just constantly on this like sympathetic nervous system, like fight or flight. Like, it feels like in any second it's all going to fall apart on you. And so you're just constantly trying to hold all the puzzle pieces together, keep it together, make it work. And you don't realize that, like, you don't have to do that, and like, it will work and it'll be okay. But you like get so stuck in that like, even years down, when it's like you're definitely okay, it's still hard to break that mentality. And you'll lose like your lead assistant that you're like, but this is my person that I do everything with. This is who I've done my sedations with for 7 years, or or your office manager that you're like, but this is the like, or even that hygienist, right? Like, one day she's
Mm-hmm.
not going to be there, and you're going to be like, how is this going to work? Like, everything's going to fall apart. And you just realize that, like, it always continues working. Like, people, whether it's team members or whether it's your personal life, right? Like, people come into your life and you need them. They also exit your life at the appropriate time too. And new things come in. Like, it's just the circle of life, right? Like, it ebbs and flows. You get the right people when you need them, and your life is gracious enough to also, separate you when you also need to be separated. And it just always works. And I feel like it took me, like, I literally sometimes have to like actively talk myself into like not going into disaster mode. Like, I remember like sitting in my office one time, and like from where my office is, like, I can see like our logo wall, like from like an obscure angle. I remember just sitting there one time looking at it being like, bro, you're good. Like, it's okay. Like, see your name on the wall. Like, you're good.
Yeah, you did the thing.
It's exactly. It's like, you did the thing. You're okay. Get off the bullet train. Like, I feel like that's the analogy I use a lot, like in my own mind, where it's like you're constantly on this like bullet train going 100 miles an hour with no end in sight and you never get off. It's like, sometimes get off, enjoy the scenery. You're good. Like, what's the point of just riding this thing if you're not getting to any destination or you're not enjoying the journey? Like, you're good. But it's so hard to do that. And it's very, very hard to do that in the beginning, especially too. Everything feels like life or death. Everything is literally just like, this person left me, when I hope it never happens to either of you. But if you ever get your first 1-star review,
We've been there.
It is just like, first and foremost, if you ever want to see who owes anybody money, look at who leaves a 1-star review. Like, it's not a real 1-star review, right? Like, let's just be clear. That's only people leaving 1-star reviews. You just don't want to pay your bill. Number one. But number two, it's like when you actually are like a good human being and an empathetic provider and not a dirtbag, and people leave you a review to even suggest as such of like, oh, you're just this scammy dentist, or like, oh, they told me I needed this deep cleaning thing, which is such a con that, I went to another office and they said I'm fine. It's like those kind of things. You're just like, listen, like, I'm not the one. Like I'm just not it. Like, there might be people that are like that, but it ain't me. Don't bring that energy here, because I can tell you my head hits my pillow just fine every single night. It's not, I'm not the one.
Yep.
Leave it elsewhere.
Yep.
Kills me.
Be free.
Yeah.
I'm glad we didn't jive.
Yeah, literally. No joke, I'm still distraught over this, and I'm trying to not be distraught. I had a patient. I don't even want to say the organization because I don't want to like throw any, because it's a wonderful organization. But I have an organization that I did a donated case on like 5 years ago. And the woman's
no good
mouth,
deed.
No, the woman's mouth was like a hot mess. And we're like a fully functioning, basically, dental lab too, right? So like typically when I'm doing a donated case, like, we're doing all the things.
Yeah.
We do all the things for her. Obviously, she doesn't take care of her mouth for another 5 years. I'm sure she's bombed out stuff, whatever. And her husband left us a 1-star review that was like, don't go here for your free dental work. No joke. But like some scathing review about how like her mouth's a disaster again. It's like, yeah, that's how that stuff works, guys, right? But it's just, I don't know. It's wild.
You gotta do your homework, people.
Right. But the things that will just like eat at your soul, where I'm like, and you just have to learn to just like turn it down, power it off, because it's wild.
Thank you for joining us for this episode of Beyond Graduation. If you enjoyed this week's episode, be sure to share it with a friend. Connect with us on social media at Savanah Craig DDS and at Dr_Sartor. And remember, you are not alone on this journey.
ADEC certified pre-owned equipment is a sustainable, affordable choice that makes genuine ADEC equipment available to every doctor. Each package is sold on a first-come, first-served basis. So, if you see one you like, contact your dealer. For more information, go to www.adec.com/find a dealer. Thank you for listening to Beyond Graduation, brought to you by Ignite DDS and Future Dentists. This episode was sponsored by Ignite DDS Coaching. We build self-determined futures. For more information, please reach out to the Ignite DDS team.